Today we will look at catheters, and we'll try to see what are the things that are there in a catheter that we should know. So whenever you see a catheter, the first thing is look at the French size. You can see the number 4 written over here. It basically means that it is a 4 French catheter. There is a 035 written. Basically it means that this will take a 035 wire. The next thing is 100, which basically means that it is 100 centimeters long. Now if you take a smaller catheter, for example, suppose we take a multi-purpose or something which is shorter. Okay, I've got a shorter catheter here. If you see here, it's difficult to read it. I don't know if you can read it, it's very tough, but it's got 70 written here. So it basically means it is 70 centimeters long. Now it's very important that you know the length, not just because you need to know how far you got to reach, but it's also important because if you're pushing it through a sheath, you should know whether it'll exit the sheath. For example, if you've got a 70 centimeter sheath, you can't take a 70 centimeter catheter. The catheter won't exit. Thirdly, also remember the length of the catheter determines the length of your guide wire, and also it's important when you want to try to exchange that catheter for something else. For example, if you've got a 100 centimeter catheter, which is the commonest size, your guide wire length should be ideally at least 180, so that you got enough length to exchange the wire. 200 is even better. Okay, you get that point? So, there are a couple of things you have to look. Also, there is a number written here, 1200, which basically means the pressure that it can take before rupture. Got it? Now, all these catheters are basically unbreakable because they got steel braiding in it. So, if you do anything to it, you see, if I kink it this way, the catheter will get kinked, but it will never break. That is because they all got steel braiding. So if a catheter does not have steel braiding, actually there is one catheter called the uterine artery catheter made by Cook, which is no longer available, the tip of which is not braided. Now this is a Merit's uterine artery catheter. Even this, the tip is not braided. In other words, if you manipulate it too much, this will break. So be careful. Remember that braided catheters are always safer, but they become a little more stiffer. So this is a very common shape, right? It's called a pigtail catheter. It's only used primarily for arch autograms, not arch autograms, right? It's got a distal hole at the tip, and it has got multiple side holes. So if you want to do the renal artery, try to keep the side holes towards the position of the renal artery so that the jets will go into the renal artery. But this has got some interesting uses other than an autogram. For example, if you are coming from the arm, that means you're coming from the arm and you want to enter the descending aorta by positioning this catheter in this direction, that is like this, and you push the guide wire, it opens like this. You get it? So what will happen is it will tend to go into the arch and the descending aorta. Have you got it? So you're coming from the right radial artery, you enter to the innominate artery, keep this catheter in this direction, open, and the wire will tend to flip. Okay, and for that you need a soft wire like a Termo wire, which will allow you to ensure the pigtail opens but not completely, right? You got that point? Also, this can be used at times for crossing an aortic bifurcation. You can just pull it down, it will hook on the bifurcation, it will open a little bit, and then you can use it to cross the bifurcation, right? Okay, there is another interesting use. You can use it if you want to do a puncture right in the center of the femoral artery. If you do a crossover technique, and if you can keep the pigtail and puncture at the center of the pigtail, you will be in the center of the artery. We use that especially when you've got a patient where we plan to do a total percutaneous approach for an aortic stent graft. Have you got it? So these are some of the uses of the pigtail. So you got a point. It's used for flush autogram. but is used also to, when you come from the arm to cross to the descending outer, can be used to cross the aortic bifurcation, can be used to puncture the center of the common femoral artery. Pigtail catheters are straight, but we also have something called an angle pigtail catheter, which will look like this. Now, the angle pigtail catheter is very useful if you want to enter the pulmonary artery. So, basically, on fluoroscopy, they look like this. So, right from the IVC into the RA, it will go into the RV, and then when you torque it, this curve will look up and you push it up, right? So, it's a good catheter if you want to enter the pulmonary artery. It's got an angle pigtail. Also, you've got a more fancy looking pigtail catheter, which is called the marker pigtail. Have a look at this. So, these are used like a scale inside the body, where you can, each mark is 1 centimeter apart. You have got 20 of these. So, basically, it's a 20 centimeter scale, used a lot when you are doing a thoracic or an abdominal aortic aneurysm repair, where we want to measure the length of the device to be used, the length of the limb to be used. So you have a scale. So this is the common use of a marker pigtail. The marker pigtail is usually in 5 French, and it tends to be a little more expensive than the routine pigtail catheter. Okay, so hope you have an idea about this catheter. So this is the commonest flush aortography catheter. Now from here we will go into selective catheters, but I hope you understood. Catheters are braided. They have got 4, 5, 6, 7 French sizes. They have got lengths which are variable, and the hub gives you all the information. In our hospital, the next most commonly used catheter is the Bernstein catheter. Okay, so the Bernstein is just like a simple right angle. Have a look at it. Can you see that? Looks like a very simple right angle catheter. It was basically created by Bernstein, who was a radiologist, the same person who made the Bernstein liquid coils. Again, this catheter is 100 centimeters long. It's a catheter which takes a 035 wire. It's all written. It actually takes a 038 wire. See that? It's written here. So you know it takes a 38 wire, 100 centimeters long, 1200 psi, but we don't use an injector here. We're using the hand. What is the use of this catheter? It is probably one of the most versatile catheters. In a patient who does not have an unfolded aortic arch, you can enter all the cerebral vessels from here. Okay, you can enter the innominate, the carotid, and the vertebral arteries all with one catheter. So you hook it, take a wire, and go. As you come down, it's a good catheter to enter the opposite iliac artery. So you come into the bifurcation, pass the wire down, and you go down, and then you can do a femoral angio, or you can do a popliteal. You can also take it down and be selective to enter the profunda. So it can work like a selective to enter the profunda, to enter the tibial vessels, or even sometimes we use it in strange positions. For example, you want to enter the gastroduodenal artery and it's not easy. Exchange it. Take any catheter, even a SIM one, take the wire of the hepatic, and then take a Bernstein, and as you pull it back, it will fall into the gastroduodenal. You can do the same thing with the superior mesenteric artery. You want to enter the branches, go down, exchange it from a SIM one, and then you can take this catheter. So you understand. So wherever you want to enter a side branch, this is a very good catheter. And to me, this should ideally be called the multipurpose catheter, right? Not the regular multipurpose. Anyway, let us show you the multipurpose catheter. Now this is called a multipurpose catheter, and it's a pretty useless catheter. This curve is not a great curve to enter anything. But if you come from the arm or the radial artery and the length is 125, then it really works like a multipurpose. It will enter the renal artery, it can enter the celiac axis, the superior mesenteric artery, the opposite iliac artery. So it's a great catheter. So this should ideally be a multipurpose catheter when you come from the arm. But otherwise we hardly use it when we come from the femoral artery. Okay. Now let's look at another common catheter that we use very often, and this is called the Simmons one. Look at that. It looks like a nice hook. So it's very easy to enter a lot of vessels. So when this catheter enters the body, it will look like this, right? That's the way it will look. When you go into the arch, it will look like this. So when you come into the arch, you have to at least spin it around to create this curve. Then you come down. As you come down, you go posteriorly, it will enter the intercostal arteries. If you go laterally, it enters the bronchial arteries. If you come anteriorly, you will enter the celiac axis, the superior mesenteric. Come below that, you will enter the renals. You can also enter the lumbar arteries as you go posteriorly, the diaphragmatic arteries, and when you come down, you can enter the inferior mesenteric artery, the opposite iliac artery. Can you get this? So it's a great catheter, probably one of the best catheters to stock in your lab when you want to enter just about any vessel in the body. The problem with this catheter, it is not a great catheter to track distally because of this tight curve. So if you enter this, you can enter the celiac axis, you pull it down, it will go a few centimeters into, but when you take the wire, when you try to track this over the wire, it's difficult because this curve doesn't allow it. So unless the wire go really distally, you'll find it a problem. So sometimes you'll have to exchange it. That means you take a exchange length wire, keep the wire inside, then take a standard catheter. There is suppose you have an unfolded outer, what will you do? You will have a Simmons one with a larger curve. See that? So look at this. This is the same thing, but the curve is much larger. So it's more useful when you're working in an unfolded outer. So you see the arch, it will hook the arch and you pull it up, right? It's a very great catheter for unfold. There's a Simmons 3 also, very rarely used in India. So this is a great catheter predominantly for the arch when you would like to enter the vessel. Sometimes we use it also in the SMA. So you hook the SMA like this, come deep down and rotate it round and enter some side branch. So it depends upon you. When you look at the angio or the CT angio, you can plan. The common of uses is an unfolded aortic arch, right? Now there is a catheter that looks like a mini sim, and that is called the shepherd's crook. See that? But the problem with the shepherd's crook, have you seen here? The length is just 65 centimeters. So it cannot go beyond the descending outer. It's primarily made as a visceral catheter to enter the SMA or the celiac axis, but we use it most often to sometimes cross a difficult aortic arch when we cross it and try to recanalize an occluded iliac artery. Other than that, it's got very little role, but the shape is this way. It's called the shepherd's crook. Remember that? Shepherd's crook. Another catheter that can look something like this is the internal mammary artery catheter. I'll just see where it is. Here it is. So can you see this? It's a nice little curve. It's a catheter created to enter the internal mammary. But we also use it, for example, you have a flush of kind of a occlusion of the iliac artery. You can try this also. Sometimes the Simmons one will keep going laterally. You can centralize it. So this is basically a catheter for the internal mammary. It's a great catheter for the internal mammary. But remember, these catheters are named after a vessel, but depending on the anatomy, you can change it. So let's just show you these. Now we'll show you some more visceral catheters. For example, this is called the double curve renal. It's a very easy catheter to enter the renal artery. Almost just falls into it, right? You can go into pull it up, pull it down, it goes in the right renal, same thing, left renal, and you have treated it, right? So you'll normally take it over a J wire, go beyond the renal artery, pull out the wire, the curve comes, and drop it into the renal artery, okay? And this is another catheter that looks more or less like this, but it doesn't have a pronounced long secondary curve, and this is called the cobra. You got it? It's supposed to look like the head of a cobra, and this is called the cobra. It's again a visceral catheter. We use it to enter the celiac axis, the SMA, the lumbar arteries, the bronchial arteries. So all of those can be entered with this, but it's not very stable. The Sim one is a lot more stable. When you tog it slightly, it can slip off, but can definitely be used. Now, one thing common with all the selective catheters, they have one single tip hole. There is no side hole. And that is important because we use it also to inject particles. And particles should not be injected whenever there are side holes present. It should only go through tip hole. Can also be used to push out 3-5 fibered coils. There again, we don't like to have a side hole. So all these catheters which I showed can also be used to inject the fibered coil. Now there are some unusual shapes which are very useful. One of them is this shape, which is called the Yashiro catheter. See that? So the Yashiro catheter is a very good catheter to do visceral angiography, especially the SMA and celiac axis. So just like the SIM1, you go up, it looks like this in the body, straight, make a curve, and as the tip of the catheter looks onto your left side, you know this is anterior. So big advantage. Whereas with the SIM1 and with the SCOBRA, it's difficult to know it's anterior posterior except while turning. So you target clockwise, if the tip moves clockwise, it's anterior. If you target anti-clockwise, if the tip moves anti-clockwise, it is again anterior. But if you turn the hub clockwise and the tip moves anti-clockwise, then it's posterior. But here it's very easy. If the tip is on your left side, it's anterior. If it's on the right side, it's posterior. So keep the catheter anterior, pull down, and it will enter into the celiac axis, okay, or the SMA. And it's a very soft catheter. So unlike the SIM1, when you pass the wire, it easily tracks. So this is called a Yashiro catheter. This is a first choice in this hospital, in our center, for the celiac axis and the SMA. So they are black in color. So they got glide cath. They got a hydrophilic coating, and they're extremely well-made catheters from Terumo. This is another glide cath again. You know it by the black color, and this is called a vertebral artery catheter. Looks something like a fusion between a multi-purpose and a vertebral. Not a great catheter. You can just use it if you have it, but you really don't have to keep it in stock. Okay. So that kind of covers a set of catheters which are used in diagnostic angiography. But remember, all these catheters which have a 3/8 lumen can also in some way look like a guiding catheter because you can pass micro catheters through it. You can take a regular prograde, you can take a 2-1 microcatheter, you can take a neuro 1-4 microcatheter through these. So then they work like a guiding catheter. So remember, this can behave also like a guiding catheter for taking microcatheter. The only problem, you cannot inject by the side, so you have to work on a roadmap, right? So you can use it as a diagnostic catheter, you can use it to inject particles, you can use it to push out coils. You can also inject glue, though rare because it's difficult, you need large volume. And also remember that some of them can be used as measuring catheters when you have the scale measure on it, right? And all of them are braided now, so they're not breakable. They come in different lengths, so it's important that you check these lengths. I hope you have some idea about these catheters and how you can use them. Remember, nothing is fixed. If you think you have a shape that might go into a vessel, just try it. It might just work. There are two other catheters which we use, which are not meant for radiology or peripheral use, and that is the Judkins right and the Judkins left catheter. Okay. Now, the Judkins right catheter is this. Looks very much like a Bernstein. You see that? Or it's like a fusion between a Bernstein and a Cobra, but it has got a secondary curve. So this curve, this is called the JR, Judkins right, can come in 3, 3.5, 4, 4.5 based on the secondary curve. So this also works like a multi-purpose catheter, but we use a Bernstein most of the time, and most of the times you may not use it, but you may use it instead of the Bernstein. But what is interesting is the Judkins left. Now this catheter, if you see, is meant for the left coronary. So what happens is, it will be like this. You push it down, it touches one wall of the aorta and pushes this in. You got it? So it pushes. As you push, it just goes like this and hooks the coronary. Now this also, depending on this length, it can be 3, 3.5, 4, 4.5. But what is interesting is, in an unfolded dilated aorta, you can use it for hooking visceral vessels. You may have a difficult bronchial artery, and this might just hook it because of this very strong curve. You get it? So we use it for difficult bronchials. Sometimes we use it for a difficult crossover in an aortic bifurcation, and or any vessel that is coming off the aorta which has got a dilated aorta which is difficult to reach. So we tend to use it in a difficult situation, and remember to keep at least one or two of the Judkins, especially in the 4 and 4.5 for a difficult visceral vessel, intercostal artery or bronchial artery which you're not able to otherwise access. So that kind of concludes a little talk on diagnostic catheters, and I hope you have some idea on what to do with it. Like we said, it's just not a diagnostic catheter, but it can also be used as a catheter for doing embolization procedures where you can inject particles, gel foam, polyvinyl alcohol sponge up to 2 microns, and also you can inject uh, coils out of it, 3-5 coils. You can also use this as a guiding catheter, put the micro out of it. Thank you. So now this is another catheter that I wanted to just add on, though it's at the end of the class. This is the uterine artery catheter. Okay. So how do you work with the uterine artery catheter? So you go up just like a multipurpose catheter, and at the aortic bifurcation you turn it around. Get that? It looks just like a Bernstein tip. Pass the wire and crossover. Go deep into the external iliac artery till this bend comes. So the bend is seen as a little radio opaque dot. Now you push the catheter up and you will get this loop. Now once you get the loop, come back into the common iliac, turn it a little. Since in the body it will turn this way as you torque it, and pull it down. Okay, so you're inside the internal iliac, and then the same way by torquing it up and down you can enter the uterine artery or the posterior division or the vessel of your choice inside the internal iliac. So it's a great catheter to basically finish both internal iliac from the same side. So once you finish it, push the catheter up, goes into the aorta, rotate it around so it comes on the ipsilateral side, pull it down. Now it's in the ipsilateral common iliac. Pull it in this direction and you enter the internal iliac. Have you got it? Right. Now remember, this is one catheter that is dangerous because the tip is not braided. Remember, the tip is not braided. Huh? Now if the tip is not braided, if you are trying to torque it multiple times, this will get knotted like this. And in the end you'll come to a situation where the whole thing is bent, and if you try to pull it, what will happen? It will break. Have you seen that? Now this is the problem. So this is a dangerous catheter because it can break. So remember, don't torque it too many times. Keep on pulling, it will break at multiple points and you will lose it. Okay. So this is because it's not braided. I talked about you before that braided catheters are wires. So this is kept unbraided so that you can have a very soft tip. There's one more catheter that I wanted to show you, and this is this unusual looking curve. Now this catheter is basically a catheter that you come from the radial route. So look at this, it's 125 centimeters. You come from the radial artery, mostly the right radial, enter into the descending aorta, and as you come down you can enter the renal artery. So if you're anterior, you can enter the celiac axis, the superior mesenteric, the inferior mesenteric, the renal, the opposite renal. You can also enter the bronchial artery. So this works like the SIM one coming from the arm, right? So it's a 125 centimeter catheter and the workhorse catheter for access of visceral vessels. Having said that, also remember, if you're coming from the arm, the SIM2 is the workhorse catheter for getting into the neck vessels. So you come from the arm, you enter this way, pull it up, you enter the right carotid, pull it down, rotate it, the left carotid, subclavian, and also the vertebral. The right vertebral alone you enter using the Bernstein catheter. I also talked about one catheter before, I'll just show it now. This is the angle pigtail catheter. Have you seen that? So look at it. It's got an angle on it. It is a perfect catheter for entering the pulmonary artery, right? So that covers some unusual shapes which I could not show you a little while ago. But just remember, these catheters are also available and are useful in difficult or different unique situations. Okay, thank you.